This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations.
Good afternoon. Welcome to today's presentation on telehealth marketing and patient engagement. My name is Katy Cook, owner of ADK Health Solutions, and let's dive right in. My apologies. There we go. So your telehealth program has been approved by executive leadership. You've taken the appropriate steps towards implementation, such as some of the other training videos I've done around needs and readiness assessment, developing workflows, connecting with specialists, selecting equipment, training, the whole 9 yards. So what's the best way to let your patients and the community at large know that your health center is soon going to be offering telehealth visits? Marketing to just your patient population can be effective, but what you want to look at is referring providers and the greater business community as a potential audience. A clear and simple marketing plan will be most effective as health center staff are not likely to have the time to conduct market research and analysis. The goal of a telehealth marketing plan is to drive awareness of the service, increase utilization, enhance the patient experience, and ultimately drive overall health center growth. For example, driving awareness. Most of your patients either don't know or maybe even don't trust telehealth as a viable option for their care. This can present both a challenge and an opportunity to adapt your marketing strategy for the long term. In today's video, we will discuss how to develop a simple but effective marketing plan that will increase the visibility, adoption, and use of a new telehealth program or service line. The target audience can vary, but will primarily be focused on your health center's patients and the community at large, including referring providers. Topics and questions we will discuss today include strategic objectives. What are your organization's goals for using telehealth? Marketing objectives. Goals of the marketing plan. This is more narrowly focused. Your marketing strategy and your target audience. What is the message and content? Who is it intended for? What makes your service different from the next clinic? What media sources will be used? What is the associated cost, if there's any? And what metrics will you track to indicate success? Once you get the patient in for their first telehealth visit, how do you plan to build their trust in virtual care? Let's first begin by discussing the broader strategic objectives that outline goals for your health center. Your strategic objective should be specific to marketing telehealth services offered, encouraging participation for patients, and ultimately providing better care, generating a long-term return on investment. Several examples of strategic objectives and goals to consider measuring include measurable return on investment within the first year of the program. Patient satisfaction with the telehealth program will exceed a certain percentage, perhaps based on patient feedback surveys. Clinician satisfaction with offering telehealth will exceed a certain percentage. Positive media coverage about the program, and maybe even achieving a certain number of telehealth encounters within the first year. Depending on the size and scope of the program or service line, this metric can vary. Marketing objectives are more narrowly focused and where the direct activities engaged in for the marketing plan will give you the most bang for your buck. Several examples of marketing objectives include the number of visitors to your website. You can use Google Analytics for this. The number of patients requesting more information on telehealth. The number of views on social media platforms or posts specific to telehealth for your health center. And lastly, patient and clinician satisfaction. This can also be a strategic goal that we just discussed. The marketing strategy will outline who your target audience is and what you want them to hear and how. For today's video, we are focusing our audience primarily on patients, then referring providers, and finally the community at large. Your marketing efforts should be focused on the patients you want to use the service, providers in the community who you want to refer their patients to you specifically for telehealth, and the community at large to assist in publicizing and advocating for the use of telehealth at your health center. The community at large can share social media posts, help distribute flyers or newsletters, and more. It's important to balance the benefits of your telehealth offerings with the potential concerns that may arise. You may need to address concerns in your marketing materials around patient privacy and confidentiality, as well as the quality of care a patient would receive virtually versus in person. As noted, you want to figure out what you want to convey in your marketing message. It is important to address the challenges each group faces and how telehealth will present unique benefits to them and resolve the challenges mentioned. For patients, their challenges center around accessing healthcare. Patients often delay care due to not being able to take time off work to drive several hours for a specialist appointment, or care is delayed because the specialist is booked out months at a time. The alternatives are often trying to find a provider locally who can help them, or they delay their care altogether to the point where they may need to be admitted to a hospital. Telehealth as a solution for patients should convey the message that their access issues can be addressed, their time is valuable, and long wait times can be reduced, and no time off work is needed to travel. For referring providers, their challenges center around losing patients to other facilities and patients delaying their care and making diagnosis and treatment tougher. The referring providers often have to make the choice of sending patients to distant facilities, which is not ideal for most, given the challenges we just addressed. Telehealth as a solution for referring providers enables their patients to receive their care locally and far quicker than an in-person appointment. This leads to a faster diagnosis and more effective treatment plan than if the issue had exacerbated. The provider also retains the patient and associated revenue. Lastly, for the community at large, members of local organizations or even employees of local businesses are impacted when they have health problems they cannot resolve. This negatively impacts their work and their home life. Without equitable access to healthcare, the alternative is for these individuals to simply live with their situation or condition, which can lead to offering consolation and resources, but no true solution. Telehealth can make these individuals lead healthier and more productive lives, which can help a business's employees be more reliable and productive, knowing their healthcare issues can be addressed quickly. Now to focus on the message. What words will you use in your marketing materials or social media posts that will attract your audience and differentiate your telehealth program from others that might be offered? The California Telehealth Resource Center created a marketing plan for a health center and used open-ended questions on marketing materials to get to the heart of the challenges that were mentioned previously. For patients, some of these questions could include, are you delaying care because you cannot take time off work to see a specialist, or the wait time to see a specialist is many months away? For referring providers, are you concerned about losing your patients to other providers or facilities if you refer them out? Are some of your patients not receiving the specialty care they need? And for the community, is your community as healthy as it could be? Are local employers losing productivity due to individuals taking time off to seek care? Once these questions have been framed, you can speak to your solution, what the hours are, ease of access, cutting wait times, how to use the service, and more. You will also want a catchy tagline at the top of your materials to get your audience to at least open the pamphlet, email, newsletter, etc. Focus on the positives of your program, highlight the reduced wait times, or even showcase a patient's success story. Now that you've crafted your message, what media sources will you use to reach your audience? Depending on your budget, some common media sources include your health center's website. This is useful for all audiences. You can highlight the telehealth services offered, physicians who are available for appointments, patient success stories, a video showing a mock visit, how to get started, a link to a newsletter, and contact information. Next up is an email blast. An electronic newsletter is a continuous way to communicate with your subscribers. Put the telehealth information front and center. Tangible brochures in the office waiting room or provided to local businesses. This is dependent on your budget as there are potential design and printing costs. A press release. This can be through a local newspaper, TV, or radio station. This avenue creates broad awareness of your offering. Social media. This is a great free option to use your organization's Facebook, LinkedIn, or YouTube page. You could create a video of a mock telehealth visit to show how the technology works, post patient success stories, and even testimonials from providers or staff who have used the technology. Patient and clinician satisfaction surveys. This is a great way to get direct feedback on your telehealth program. The results can drive your future marketing efforts. Provider and patient interaction during an in-person visit. This is a great opportunity for a provider to inform and educate their patient about the telehealth program. Look at the patient's current situation and social determinants of health. Shape your conversation around those factors that limit the patient's ability to make their in-person appointments. This can be used to your advantage to continue seeing them. The goal at the end of the day is to be consistent in your messaging and communicate the benefits of telehealth. You want your patients to at least know that the option is there for them, and if they use it, spread the positive experience that they had. The last component of a successful telehealth marketing initiative is measuring your success. Marketing efforts should produce results. We briefly discussed some objectives earlier in this video, but we'll now highlight some targeted metrics that will indicate success within the first year of your telehealth program. Number of website visitors. This can be easily tracked through Google Analytics. Number of subscribers to an electronic newsletter and how many of them actually open the newsletter or click through. Satisfaction scores for patients and clinicians. Strive for an 80 to 90% satisfaction rate. Number of views and shares of social media posts, and number of views on YouTube videos. The outcome of any successful telehealth marketing initiative is now the patient is in your care in a virtual setting. How do you keep them engaged and eager to continue with virtual appointments? Anthony Orsini was quoted as saying, "Communication is the #1 factor influencing the patient experience, and one interaction can change the course of someone's life." Patient engagement is defined differently depending on who you ask or what organization is defining it. Patient engagement can mean their willingness to manage their own healthcare and what tools or technology allow them to feel empowered to take a more active role in their care. It can also be how providers engage their patients to make them feel supported, cared for, and willing to continue down a path to a healthier life. Person-centered care combined with tools that allow greater access to health information leads to increased communication and improved patient outcomes. Building trust with your patients through telehealth can take time and effort on the part of your providers. Allowing patients to see their visit notes in an electronic patient portal is a great way to improve that relationship. Patients tend to forget most of the information they receive during a visit. Allowing them to access notes after the fact can help them to better remember, understand, and act on the advice given. This also promotes transparency. Providers should make sure to explain to their patients what they can expect to see in the notes and use plain language that is health literate and easy to understand. Making a virtual visit more patient-centered also involves direct eye contact. Make sure to look directly at the camera and not at the screen. Take the opportunity to ask the same questions that you would during an in-person visit and verify their information and vitals if at all possible. Make sure the exam room or home office of the provider has good lighting and is not backlit. Have a simple background and be careful to minimize background noise or excess paper shuffling or typing. These few extra steps will ensure that the virtual visit is as close to an in-person as possible and makes the patient feel at ease, especially if this is the first time they're engaging in virtual care. While virtual care does require new techniques, the main principles of patient-centered communication still apply. Ask patients about their goals and preferences at the start of the visit. Practice active listening by summarizing what they say and reflecting their statements back to them. Give them space to be heard and use open-ended language. Employ shared decision-making and ask the patient to repeat back the plan of action to ensure they understand. Let them end the visit first. Ultimately, patients need to be heard and understood, whether in person or via video or audio. Technology doesn't need to undermine a provider's ability to engage on a personal level. Instead, it can be a tool to enhance your ability to connect with your patients. COVID-19 has shown us that. When it comes to delivering care, technology is no longer nice to have. And as COVID-19 continues to spread across the globe in many forms, it's necessary to ensure seamless care for patients, both with and without a pandemic. From a patient's first appointment to continuation of care, technology is helping providers to further their care and deliver it effectively and seamlessly in ways that are enjoyable and easy for the patient. Gaining proficiency in telehealth takes time, but with the right guidance, processes, and support, providers offering telehealth can continue to make a difference in patient care and outcomes. Establishing a virtual model that positions providers for success while paying close attention to the patient experience will be critical to meeting demands for care during this health crisis and beyond. I've included some additional resources here in terms of patient engagement and marketing tips for your telehealth program. I thank you for joining me today and listening to this presentation. Until next time, goodbye.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.